different kinds of health issues, but let us focus more on the most common health issues. First is cardiovascular disease. Cardiovascular diseases, primarily heart disease and stroke, are the leading global cause of death according to the World Health Organization or WHO. Health factors that contribute to heart disease include high blood pressure, elevated glucose levels, and raised lipid levels. The instance of heart disease in obese patients can be addressed through public health programs that aim to improve diet and exercise habits and promote weight loss. These programs educate community members on risks such as dangers of eating energy-dense foods with high fat and sugar contents, health impacts of physical inactivity, and cardiovascular risk related to smoking. The next health issue is type 2 diabetes. Diabetes is another top cause of death worldwide. The condition occurs when the pancreas doesn't produce enough insulin, type 1 diabetes, or when the body cannot process insulin, the type 2 diabetes. Over time, diabetes may cause damage to the heart, eyes, kidneys, nerves, and blood vessels. Abdominal obesity is connected to a number of metabolic disorders, including insulin sensitivity and glucose intolerance, two key factors in the development of diabetes. Obesity can also increase the risk of complications from diabetes, such as diabetic neuropathy. The third health issue is hypertension. Another symptom of obesity is hypertension, or high blood pressure, which is a key contributor to heart disease. Screenings for high blood pressure are part of routine preventive care protocols. However, some populations don't have proper access to routine medical care or can't afford care services. Millions of adults have uncontrolled hypertension, which can be managed with diet, exercise, and medication. The fourth health issue is schizoaffective disorder. Schizoaffective disorder is characterized by symptoms of both schizophrenia, such as delusionals or hallucinations, and mood disorders such as depression or mania. The condition is also marked by disorganizing thinking and depressed mood. The condition can be caused by stress, genetics, and brain chemistry.
According to the World Health Organization, on its record for this year, 2021, the leading health issue is the very timely COVID-19 issue. As of 1st of May 2021, more than 153 million confirmed COVID-19 cases and 3.2 million related deaths have been reported to WHO. The region of the Americas and the European region have been the most affected, together comprising over 3/4 of cases reported globally, with respective case rates per 100,000 population of 5,999 and 5,455. Of the 23.1 million cases reported in the Southeast Asia region to date, over 86% are attributed to India. Almost half, or 48% of all reported COVID-19 associated deaths have occurred in the region of the Americas, and 1/3, or 34%, in the European region. Next to this are the cardiovascular diseases and more non-communicable and communicable diseases. Here's the data on how the different categories of diseases affect each age bracket. The percentage will represent how many of the totality are affected by the category of diseases. For the communicable diseases, we have 15% for ages 75 and up, 8% for ages 55 to 74, 7% for ages 35 to 54, 9% for ages 25 to 34, 7% for ages 15 to 24, 6% for ages 5 to 14, 7% for ages 1 to 4, and 60% for ages below 1 year old. For the non-communicable diseases, or diseases that cannot be transmitted, we have 70% for ages 75 and up, 78% for ages 55 to 74, 73% for ages 25 to 34, 49% for ages 15 to 24, 42% for ages 5 to 14, 41% for ages 1 to 4, and 33% for ages below 1 year old. For the external causes of injuries and ill-defined diseases, they have less percentage in the totality of this record. The sum of these two categories covers the remaining 15% for the ages 75 and up, 14% for 55 to 74, 18% for 25 to 54, 42% for 15 to 24, 52% for 5 to 14, 42% for ages 1 to 4, and 7% for below 1 year old.
In today's world, lots of health issues that the individuals experience. So we recommended to consult your doctor, have a daily checkup, eat healthy foods, and have a daily exercise. There are also lots of programs that the government implemented, like AIDS education, health promotion and education in schools, seminars on health topics such as fitness, nutrition, tobacco cessation, and stress management. There are also weight loss programs that offer counseling and education, and there are also barangay nutrition scholar programs.
Health issue has no specific solution, but we can prevent it by making yourself physically fit. Physically fit means maintain a healthy weight, exercise regularly, don't smoke, eat a healthy diet, drink alcohol only in moderation if at all, protect yourself from the sun, protect yourself from sexually transmitted infections, and get a screening test. If you will attend this, you are away from diseases or healthy problems.
Intervention. What are interventions in healthcare? We use the term intervention to apply to any activity undertaken with the object of improving human health by preventing disease, by curing or reducing the severity or duration of an existing disease, or by restoring function lost through disease or injury.